let me tell you something that every international doctor learns the hard way. It's not enough to have studied medicine. You have to know how to show the medicine you have studied and to show it the right way. And every year I meet brilliant IMGs who graduated top of their class overseas in various universities across the world. But when Canadian reviewers open their CV, it looks so confusing, mismatched dates, incomplete rotations, and missing institutions. Now, a few months ago, I dealt with a doctor named Dr. Anita. She reached out to me and she said, Dr. Brony, I have a medical degree. I even have a master's in public health, but I keep getting asked for clarification. When I looked at her CV, I understood why the reviewers were asking for clarification, because her educational section was very short and vague. It simply stated something like this: MBBS, University of Ibadan, 2008 to 2014. Residency, family medicine, 2015 to 2018. That's it. No details, no clarity, no structure. Your education is powerful, but you have to translate it into Canadian clarity. And here's how we rebuilt her CV and how you can do the same in order to show your education so that reviewers don't get confused about it. So number one is you've got to start with your medical degree. And with your medical degree, you want to include the full name of the university you attended, the city and the country that university can be found, then the exact start and end dates, the month and the year. So for example, you can state something like this: Bachelor of Medicine, Bachelor of Surgery, so that is, and into bracket MBBS, University of Ibadan, Nigeria, October 2008 to March 2014. Now, step two is you've got to add postgraduate training and residency details. And if you've done residency or internship in your home country, list each rotation with a name, with a specialty, with an institution, and the duration. So for example, family medicine residency program, Lagos University Teaching Hospital, Lagos, Nigeria. Then you write a time, March 2015 to February 2018. Then you bullet the rotations underneath. So for example, internal medicine, 13 weeks, pediatrics, 13 weeks, obstetrics and gynecology, 13 weeks, general surgery, 13 weeks, emergency medicine, 13 weeks, family medicine, 35 weeks. So that is the level of structure that tells reviewers this doctor has a full and balanced foundation so far as their training is concerned. After we rebuilt the CV with these details, education section stretched from 3 vague lines to 1 clear professional story. And when she reapplied to the PRA program, boom, the assessor said, thank you for making your training easy to follow. And I really like that statement, because then it was like the assessor knows that, okay, now we are getting somewhere, because that is the compliment you actually want, right?